Hi, this is James of Megalife 21, hardest hitting internet talk radio station on the planet, and I am here at the Newsletter Censored Research Center in northeastern New Jersey with the Reverend Dr. William J. Eisman, and we are talking about healthcare reform, Obama's healthcare reform, and how the evil right wing is trying very hard to sabotage it. Now, what you were saying made a lot of sense, Reverend Bill. All right, the seniors are concerned about preserving and saving Medicare because they simply cannot afford to pay the co-payment to the doctor, and they obviously can't afford to pay the deductible, right? Because it's much larger.
That's the same. Co-payment is the deductible.
Oh, okay.
I mean,
sorry.
The deductible is that's nothing. That's like $100 and some or something. And once you fulfill that, the rest.
Right.
The problem is that Medicare only pays 80% of your bill. You are responsible for the other 20%.
But the poor.
This is breaking people.
But the poor and the seniors living on a fixed income can't
afford
to pay that
exactly.
20%.
So if there's a problem with Medicare, there's the problem.
If somebody,
it has nothing to do with the government running the program.
Yes, I mean, if somebody who just has Medicare is in a hospital for 3 days getting tests after tests because they thought they had a heart attack, and they end up ringing up a $20,000 medical bill for their so-called room and board that they charge you so much for.
Right.
In
So
a hospital.
Medicare will pay $16,000. You're responsible for $4,000.
It's a real 5-star hotel, room and board.
Well,
so anyway, they can't afford that.
$25 for an aspirin.
Yeah, they can't afford that. I mean, and then 20% is 20% is too high for these people. So they probably end up applying for charity care or something.
No, they go bankrupt.
Or they simply go bankrupt and lose their...
60-some% of people are going bankrupt now due to medical charges that they can't pay.
Yeah. Life savings getting wiped out. And meanwhile, these congressmen and senators and their families have the very best, and it's free, right? They don't have to pay for anything they get. Did somebody tell me that if a senator or a congressman gets elected and they only work for like 2 days and then they get thrown out, that they're still entitled to free health care?
Yeah, something like that.
For the rest of their life?
I saw something to that effect the other day.
I mean, why should...
I think they get their pension too.
Besides, they get their pension. Why should people making over $100,000 a year get free health care and a pension? They can't afford to pay for their own health insurance for $100 grand a year. They can't afford.
They're rich. They deserve more than you.
They deserve freebies. Yeah, but they can't put into their own IRA, their own retirement.
They could.
I mean,
well, why do they have to when you're putting it in?
Because you know what the problem is? The people let them get away with it. Simple as that. They let them get away with it. They continue to vote the two-party system.
We've been letting them get away with what? No taxing on the people. Now, right now, to pay for health care, the first thing you want to do is rescind the Bush tax cuts.
Yeah.
Okay? That's the first thing you do. There's over $1 trillion coming in.
And eliminate the offshore tax havens completely.
Then you go after that stuff too. There's a whole bunch of savings that can be done.
But when you think about it, you're making, let's say you're a senator, and let's say you're making 150 grand a year. You could very easily save for your retirement and pay for your own health insurance. The best, what is it, $1,000 a month for a decent health insurance plan?
I don't know.
I know one person I know is paying $750 a month for a mediocre, now I would say not mediocre, a moderately good plan. Moderately. They can afford to pay for their own shit. It's incredible.
But that's what they do. The insurance business right now is corrupt. It's screwed up. Now you're talking about a mediocre plan.
Career politics is corrupt.
Every plan should pay everything.
Right.
Okay?
Why does Medicare not pay for dental?
They should not discriminate. Well, why should Medicare not pay for vitamins and minerals?
Right.
If you're talking preventive medicine, well, there's the way to go. prevention.
Right.
You know.
You mean an updated daily recommended allowance for people, not the crap they have now, not 60 milligrams of vitamin C and 30 milligrams of vitamin E.
Yeah. But Medicare should pay for that
Right.
stuff. You should be able to bill.
And not
they pay for right now your diabetic stuff that comes in the mail to you.
And not that crap vitamins that the pharmaceutical industry puts out.
You can buy your own vitamins.
Not your Theragram, your Centrums and all that shit. I'm talking about good companies like Twin Lab.
And go to a health store to buy good stuff.
And Solaray, you know.
Not,
go to a health store.
Not in a drugstore all the time, or
go online.
Pathmarks and ShopRites and stuff.
No.
Health stores where you get good stuff.
Yeah, buy a good reputable brand name supplement. But this is the point. Education. If they want to cut the cost down, they need to educate people with the truth about prevention, like not ignoring the preventative, holistic nutritional movement by people who really know their shit, like Dr. Gary Null, Julian Whitaker, and people like that. And listen to them, and not listen to those registered dietitians that are not qualified to give anybody any serious nutritional advice. They're not. They're only glorified meal planners. They're glorified meal planners. They're not. They don't know how to treat and prevent disease through nutrition. No.
And they prevent you from learning that because they fudge studies. They make their own studies, because the sugar company will make a study and say, oh, sugar is good.
Oh,
That's what we have today.
Yeah, the food industry.
Yeah.
There we go again. Lobbyists from the food industry paying people off to advertise that their crap is
the best crap around.
Is the best crap around, and it's good for you too. Why people don't realize why supermarket products are loaded with garbage and chemicals to increase shelf life, because the food industry doesn't want to take a loss. In the old days, natural or organic food that was actually good for you was very perishable.
Locally grown
was perishable.
Locally distributed.
If you don't sell it
within... You go to the market every day. You got your food.
Well, and it was local, though.
Yes, of course.
You didn't have to go far.
No.
You didn't have to ship fruit from Chile, South America, laced with DDT or God knows what they use down there.
Yeah.
You got everything local, and it was organic. And they used natural fertilizers, not synthetic fertilizers, and you didn't have genetically modified foods and plants like that Monsanto is trying to push. Another evil entity, along with Microsoft and ExxonMobil and all the other demons.
You think Sarah Palin would say something like Monsanto is an evil corporation, or just that Obama's plan is evil?
Oh yeah, the liberal Democrats are evil. Secular humanists. Oh, Obama's health care reform is evil, but not big business in the United States. Oh, they're not evil.
No.
Like Reverend Bill said, Monsanto is not evil. ExxonMobil is not evil. What did I say? Microsoft, whom I hate. Bill Gates, I hate his stinking guts, and I hate Microsoft, and I hate Microsoft products. That they constantly want you to pay for every little thing, every upgrade, everything they create. They want you to pay for garbage, and all they do is change the aesthetics. Features. The new operating system, from XP to Vista, they change the features. Coloring, and repackage it, and then sell it for, I don't know, $300. But you got to buy everything separate. That's why we promote Linux distributions, like Linux Mint. That's where you want to go. Has everything Microsoft has, but for free. Every program that Microsoft has, Linux Mint has one that does just as good, if not much better, for free. But anyway, so that's it. Gotta take a little break.